Uh, right now, the affected countries need much more international help than what they're getting. And I think that is important to understand that although there's no cure for Ebola, which can be quite scaring, the disease can be contained. And there have been several outbreaks since the virus first appeared, and they were all contained. So what is different now is that it appeared in more densely populated and urbanized areas. So we need a massive effort to contain this outbreak, and that requires not only information but also the ability to identify the cases and isolate the patients. And these countries, their healthcare systems, they cannot cope with that. And it is important to remember that Liberia and Sierra Leone, they have gone through extremely long and violent wars, and they were still recovering for that violence. But at the same time, we know that both countries, the governments in both countries spend more than 15% of their budgets on health. So this means that they were making a serious effort to improve the health system. But they do not have the human and the material means to deal with this threat right now. We know that, for example, both in Liberia and Sierra Leone, there are less than 2 doctors per 100,000 people. And the number in the United States, it's 250. So we can see that there's a huge gap between, they still have a lot to, a huge challenge ahead. I would say that the first thing is that they need medical and health care personnel. And also associated with this, they need equipment to protect the people that are working in those environments so that they do not risk being contaminated. And so these two things are, I would say, really pressing needs. But it is also needed people with experience in dealing with emergency situations, because there's a lot of work to be done besides taking care of the patients and tracing the cases. And also, another thing is that what is happening now is that regular hospitals in most affected areas are closed because the health professionals who work there, whether were contaminated or they just ran away because they're afraid of being contaminated. So most people who are not infected with Ebola virus but still need medical assistance, they're not getting it. I'm thinking about pregnant women or sick children, because whether the hospitals are closed or they don't even go there because they're afraid of being contaminated. So what is important is that these governments have the means to both keep these hospitals running and functioning, and at the same time to create more Ebola care centers where they can assist patients who are infected with the Ebola virus.